Good afternoon, everyone. We will get started here in a moment. Okay, welcome and thank you for joining us for the TD SYNNEX Public Sector Spotlight Series. We're thrilled to have you here as we dive into the future of healthcare trends and innovation. Today, we have the privilege of hearing from Meg Lehman, our Healthcare Program Manager with the Vertical Alliance team here at TD SYNNEX. Meg, take it away.
Thank you, Felicia. As we're looking at the healthcare market here at TD SYNNEX in 2025, there's a lot of opportunity with a total addressable market of $370 billion. At TD SYNNEX, we are wanting to segment the overall healthcare market into three submarkets: provider, payer, and life sciences, because each have their own challenges that they're facing and wanting to dive deeper into some of the technology solutions that can meet some of their unique needs. For the provider industry, some of the key challenges we're going to talk about today are access to care, revenue cycle management, and workforce challenges. For payer, payment integrity, quality and value-based care, and interoperability. And then last with life sciences, regulatory changes, research and development speed, and supply chain management. Though each of these submarkets do have their own challenges, there are some challenges that are shared by all three in the whole healthcare ecosystem. Nothing new here with cybersecurity. All three are trying to improve their patient-centric care, and cost management is very important for all three submarkets. First, let's dive into some of those shared challenges across the healthcare ecosystem. With cybersecurity, as I said, definitely not a new challenge that the healthcare industry is facing, but it's not going away anytime soon. Cybersecurity threats continue to rise, with 92% of healthcare organizations being targeted in the past 12 months, which is up from 88% in 2023. Some of the challenges that the healthcare industry is facing with cybersecurity include legacy systems, as many healthcare organizations still rely on outdated technology, which can be more vulnerable to cyber attacks. Third-party risks, as attacks on third-party service providers used by healthcare systems can have widespread impacts, as seen with the ransomware attack on Change Healthcare, which affected numerous hospitals. Large volumes of devices. Healthcare is becoming increasingly digital, and that's increasing the number of vulnerable devices on their system. Data and privacy compliance. It's always important to ensure compliance with regulations like HIPAA while protecting patient privacy. And resource constraints. Many health systems have limited budgets and resources, which can hinder the implementation of robust cybersecurity measures. However, some of the top cybersecurity technologies that healthcare systems are adopting include AI and machine learning, as these technologies help in detecting and responding to threats in real time by analyzing patterns and identifying anomalies that could indicate a cyber attack. Blockchain used for securing patient data and ensuring data integrity. Blockchain technology provides a tamper-proof ledger that can track all changes made to health records. Zero trust infrastructure. This approach ensures that no one inside or outside the network is trusted by default. It requires continuous verification of users' identities and access privileges. Endpoint detection and response. EDR solutions monitor and respond to threats on endpoints such as computers and mobile devices, providing real-time visibility and protection. Multi-factor authentication. which adds an added layer of security for requiring users to provide two or more verification factors to gain access to systems. Cloud security solutions, as healthcare providers increasingly use cloud services, robust cybersecurity measures are essential to protect data stored and processed in the cloud. And last, Internet of Medical Things security. With the rise of connected medical devices, securing IoMT is critical to prevent unauthorized access and ensure the safety of patient data. Moving on to patient experience, which is becoming increasingly important for all healthcare organizations as they're needing to improve their relationships with their customers, members, and patients. 92% of individuals stated that having a good patient experience is extremely or very important to them. So, healthcare organizations are needing to make retail-like approaches to their patient experience. Some of the main challenges facing the industry in this area are access to care. Barriers like insufficient insurance, geographic limitations, and inconvenient office hours delay treatment and negatively impact health outcomes. Staffing shortages, as overworked staff and longer wait times due to staffing shortages decrease quality and patient satisfaction. High labor costs limit resources for patient care, leading to longer wait times and reduced service access. Managing vast amounts of patient data securely and efficiently is critical but difficult due to patient data silos, legacy systems, and cybersecurity threats, like we mentioned before. Technology is greatly helping healthcare organizations improve patient access. AI-powered chatbots and virtual assistants help manage patient inquiries, schedule appointments, and provide information 24/7, reducing the workload on human agents. Omni-channel communication platforms integrate various communication channels, such as phone, email, chat, and social media, into a single interface, ensuring a seamless patient experience across all touch points. Interactive voice response systems automate call routing and provide self-service options, allowing patients to quickly reach the right department or get answers to common questions. Cloud-based contact centers solutions offer scalability, flexibility, and enhanced data security, making it easier for healthcare providers to manage their contact center operations. Customer service Customer relationship management systems help track patient interactions, manage data, and personalize communication, improving overall patient engagement and satisfaction. Speech analytics technology analyzes voice interactions to gain insights into patient sentiment, identifying areas for improvement, and ensuring compliance with regulatory requirements. And robotic process automation can automate repetitive tasks such as data entry and appointment scheduling, increasing efficiency and reducing the potential for human error. And as we're looking at these shared issues across all of the healthcare verticals, as you can see, these various technologies that are improving patient experience and creating a robust cybersecurity infrastructure also have great cost savings for the organizations, which is a key driver for a lot of their technology adoption. Next, let's look at the provider submarket, which includes any patient care settings like hospitals, long-term care facilities, um, home health programs, and those sort of companies. A lot of what we're talking about today are software, AI, networking, things like that. But I did want to take a minute to look at the different technology needs within the patient care settings. This slide is pretty overwhelming, but as I mentioned before, healthcare is becoming more and more digital. And so the amount of places that patients can receive care is only expanding, and there's just so many different areas where we can implement technology. anywhere from an ambulance needing tablets, laptops, mobile devices for navigation and communication, patient reporting and access to medical records, personal emergency devices to ensure EMT safety, video cameras for driver behavior monitoring, evidence and documentation and training for continuous improvement. We have lab draw settings for patients where obviously a computer, mouse, keyboards, all of those usual technologies are needed, but also some of the unique needs in these areas include barcode scanners and label makers. The physician offices, hospitals, and surgery centers obviously also need computers, laptops, tablets, and mobile devices, along with all of the cases that are required to protect those devices. They need servers, networking, printers, scanners, and backup and recovery systems. But we're also seeing a lot of opportunities for different types of cameras, uh, surveillance cameras for security, but also in the supply closets or areas where you're dispensing drugs to make sure that all is being done safely and in compliance. There's also so much opportunity for putting cameras in patient rooms to detect if a patient's trying to get up out of bed and prevent a fall injury for that patient. And then in more unique care settings that are rather new to the healthcare industry that we're going to explore later on, we have home care, which requires, mobile devices like laptops and tablets, of course, along with cases and carrying accessories. But the need for personal emergency devices here as keeping these healthcare workers safe as they're going into these patient homes, wearable devices for fitness tracking and fitness trackers for patient monitoring, obviously cameras for telemedicine, and then endpoint devices capturing all this data back at the hospital for the clinical staff that's monitoring all of this. Diving into their access to care challenges, um, a lot of healthcare providers are having increasing patient demand and also continued staffing shortages. So, health systems are needing to implement or expand their flexible healthcare touch points, some of which we just spoke about. So, some of the challenges that the industry is trying to address is obviously access to care, as it's difficult for patients in remote or underserved areas to receive timely and adequate care. Healthcare costs. Telehealth can generally be less expensive than in-person consultations. So, some of these interventions can curb healthcare costs. Chronic disease management. More and more patients in the United States are developing chronic diseases. And so, having the ability to provide continuous and effective care for patients with these conditions is important. Healthcare workforce shortages. There's honestly just a lack of healthcare professionals to meet the patient demand and patient satisfaction. It's just not always convenient for patients to have to come in person to receive care now, and technology can allow for more flexible and remote care to be provided. So, some of the technologies that the industry is adopting to support these access to care initiatives include telemedicine platforms that enable remote consultations, allowing patients to access healthcare services from the comfort of their homes. And this is especially beneficial for those in rural or underserved areas. Mobile health apps that provide patients with tools to manage their health, schedule appointments, access medical records, and receive reminders for medication and follow-up visits. AI-powered tools that assist in diagnosing conditions, predicting patient needs, and personalizing plans enhance the overall quality of care. Wearable devices like fitness trackers and smartwatches can monitor vital signs and other health metrics in real time, providing this valuable data to their healthcare providers and empowering patients to take an active role in their health. Remote patient monitoring technologies allow healthcare providers to monitor patients' health conditions remotely, reducing the need for frequent in person visits and enable timely interventions. And Hospital at Home delivers hospital level care to patients in their own homes, reducing the need for hospital stays and allowing patients to receive acute care in a familiar environment. The revenue cycle is quite a challenge for healthcare providers, but it's important as an efficient revenue cycle ensures timely and accurate billing, maximizes revenue collection, and minimizes financial losses, leading to improved cash flow and financial stability for healthcare systems. This enables better investment in quality patient care and compliance with regulatory requirements. However, some of the challenges that the industry faces in regards to their revenue cycle management are complex billing processes as frequent changes in healthcare payers require requirements and the complexity of billing and coding can lead to errors and delays in claims, and this often results in lost revenue and increased administrative costs. Rising claim denials, these are a significant issue and often caused by incorrect patient information, coding errors, and rapidly changing payer requirements. These denials can delay payments and negatively impact the financial health of healthcare organizations. Financial responsibility. There's a rise in high deductible health plans, and patients are responsible for a larger portion of their healthcare costs. And collecting these payments can be challenging, leading to cash flow issues for providers. Regulatory changes. The healthcare industry is constantly evolving, and new regulations and compliance requirements emerge regularly. And keeping up with these changes is essential to avoiding penalties and ensuring smooth revenue operations. Staffing shortages, again, there are not just labor shortages in the clinical area, but also in more of these administrative areas. And so this is an industry strain on resources, making it difficult to manage the revenue cycle efficiently. And that only contributes to those billing and coding errors that have already been mentioned. And last, though, we're going to talk about some key technologies that can help healthcare providers with their revenue cycle management. Technology integration can be difficult. Um, Technology can streamline the revenue cycle process, but it's important to ensure that all the systems will work together seamlessly in order for these technologies to help healthcare providers. Some of the technologies that healthcare providers are exploring and implementing to assist with the revenue cycle are, again, artificial intelligence. I think this is going to be a word that you hear a lot throughout the slide deck. But AI can be used to optimize billing processes by analyzing data to identify patterns, predict claim denials, and suggest corrective actions. It automates routine tasks such as data entry and claims processing, reducing human error and speeding up the billing cycle. Electronic health record integration is key for any technologies that a healthcare provider may be implementing. As I said before, technology integration can be a big challenge for healthcare providers. So, integrating revenue cycle management technology with their EHR system allows for the automatic transfer of patient information between the clinical and financial departments. And this minimizes manual data entry, reduces discrepancies, and ensures accurate billing. Blockchain technology provides a secure and transparent method for managing financial transactions within RCM, and it creates an immutable ledger of all transactions, ensuring data integrity and reducing the risk of fraud. Robotic process automation. It can automate repetitive tasks, again, like claims processing, payment posting, and denial management. And this increases the efficiency, allowing staff to focus on more complex tasks. Cloud-based RCM solutions offer scalability, flexibility, and enhanced data security, and they enable healthcare providers to manage their RCM processes more efficiently and access real-time data from anywhere. Predictive analytics tools help healthcare providers forecast revenue, identify trends, and make data-driven decisions. And these tools can also predict potential issues such as claim denials and provide insights for proactive management. And then patient payment portals. Again, making things more convenient for patients and improving that patient satisfaction and engagement. These portals allow patients to view and pay their bills online and set up payment plans, access their payment history, and this improves the overall patient experience and increases the likelihood of timely payments. Workforce. Nearly half of healthcare providers report experiencing symptoms of burnout, highlighting the urgent need for solutions to support the healthcare provider workforce. Some of the challenges healthcare care providers are facing are administrative burdens, as healthcare providers often spend a significant amount of time on administrative tasks such as documentation, billing, and scheduling. And AI can automate these routine tasks, reducing the administrative burden and allowing providers to focus more on their patient care. Diagnostic accuracy, diagnosing medical conditions accurately and quickly is crucial, and there's now a lot of AI-powered diagnostic tools to assist with this. Predicting patient outcomes and identifying high-risk patients can be challenging, um, and there's a lot of opportunity for automation of analyzing large data sets to predict potential health issues. Workforce shortages, the healthcare industry, obviously, as we've talked about numerous times already, is facing workforce shortages, which can lead to increased workloads and burnout among providers. And then data management. Managing and analyzing vast amounts of patient data can be overwhelming. And so we're going to talk through some of the technologies that are augmenting provider workflows to assist with the data that comes along with the immense patient records that they're trying to analyze. Some of these are medical and imaging diagnostics, AI algorithms that analyze medical images such as X-rays, MRIs, or CT scans can detect abnormalities and assist in diagnosing conditions more accurately and quickly than traditional methods. Predictive analytics, AI models predict patient outcomes, identifying high-risk patients, and suggest preventative measures, helping to reduce hospital readmissions and the overall patient care. Personalized treatment plans. AI can analyze patient data to develop more personalized treatment plans, ensuring that each patient receives the most effective therapies based on their unique medical history and genetic profile. And virtual health assistants are AI-powered chatbots and virtual assistants that provide patients with 24/7 access to medical information, including appointment scheduling, symptom checking, and this can improve patient engagement and satisfaction. I think the key with some of these technologies is not that they're going to replace the provider, but they're going to augment them, as you know, the vast amounts of data that come from patients and their medical records is just very overwhelming for providers to have to sift through. So getting to implement some of these technologies just to make their reach go further and speed up some of these more manual processes can go a long way. Now we're going to dive into the payer submarket, which are any of our health insurance payers, such as Medicare and Medicaid at a national and state level, Blue Cross Blue Shield, United Healthcare, really just any of our health insurance payer organizations. Value-based care and payment integrity. First, talking about payment integrity, that is simply the process of ensuring accurate and timely payments for healthcare services rendered. And so there's a really big push for this in the payer world. And coupled with the rise of value-based care, it can present a big challenge for payers who are trying to ensure those accurate claims adjudication while also managing intricate value-based care contracts that demand precise quality and efficiency measurements. Because value-based care is where the payers are moving from the fee-for-service models, which are where they just pay providers for the services rendered no matter what. Value-based care is more looking at what are the patient outcomes that these healthcare provider services are providing. And so some of the challenges with this for the payer industry are integrating data from various sources to provide a comprehensive view of patient care can be rather complex. Developing accurate metrics to measure patient outcomes and provider performance can be difficult. The complexity of billing processes and coding can lead to errors and inefficiencies, as we just heard from the provider perspective, how complicated it can be. The payers are the ones receiving all of those errors from the healthcare providers and having to sift through it. Legacy systems, many health plans still rely on outdated systems that are not equipped to handle modern payment integrity solutions. And there's high administrative costs associated with managing payment integrity programs. So this can be a burden for the payer industry. But luckily, there's a lot of technologies that are able to help with this from the payer perspective, and they're starting to adopt artificial intelligence. Again, the big buzzword, AI is being used to analyze claims data, detect anomalies, and identify potential fraud, waste, and abuse. And it helps in improving payment accuracy and reducing administrative costs by automating complex processes. Predictive analytics tools forecast trends and identify high risk claims, enabling payers to proactively address issues before they escalate. And this technology supports value based care by providing insights into patient outcomes and care quality. Blockchain technology ensures the security and transparency of transactions by creating an immutable ledger, and it helps in verifying the authenticity of claims, reducing the risk of fraud. Prepayment claims editing allows payers to review and correct claims before they are paid, reducing errors and ensuring payment accuracy from the start. It can integrate with AI to enhance the efficiency of this claims process. And last, cloud-based solutions. They offer scalability, flexibility, and enhanced data security. They enable payers to manage their payment integrity processes more efficiency and access real-time data from anywhere. Interoperability. Healthcare payers are focused on improving interoperability this year to comply with stringent regulatory mandates, enhance care coordination, and reduce administrative burden. But there are some challenges in achieving interoperability. Data silos exist as health data is often stored in disparate systems, like legacy systems, making it difficult to access comprehensive patient information. Um, Standardization, there's overall a lack of standardization in data formats and protocols, and this can hinder the seamless exchange of information between different healthcare entities. Keeping up with evolving regulatory requirements, such as the 21st Century Cures Act, requires significant investments in technology and training. And many healthcare systems are trying to ensure that when they're improving this interoperability, that the data that they're exchanging is secure because of the sensitive health information. So trying to maintain the patient privacy is a major concern. And then, like we've already said, cost. These can be high cost implementations to maintain interoperable systems is expensive and requires substantial financial resources. However, some of the technologies supporting the payer industry's goals of improving operability include artificial intelligence um, used to analyze oh, pause. Felicia?
I gotcha.
Oh, sorry.
No, no, you're okay.
I'm like, oh crap, I don't think I have the right talking points on this one.
That's okay.
Healthcare payers are focused on improving interoperability this year to comply with stringent regulatory mandates, enhance care coordination, and reduce administrative burdens. However, achieving interoperability can be a challenge due to data silos. Health data is often stored in disparate systems that don't communicate well with each other, making it difficult to access um, comprehensive patient information. There's a lack of standardization with the data formats, and this can hinder the seamless exchange of information between different healthcare industries. Um, there's many different health organizations using outdated systems, like we've spoken about a lot throughout this presentation, making it difficult for them to integrate with one another. Keeping up with evolving regulatory requirements, such as the 21st Century Cures Act, require significant investments in technology and training. And data security and privacy is still key here, ensuring the secure exchange of sensitive health information while maintaining patient privacy is a major concern. However, there are a lot of technologies that the healthcare payer industry is implementing to improve interoperability. Application programming interfaces enable different healthcare systems to communicate and share data efficiently, and they facilitate real-time data exchange, improving the accuracy and timeliness of information shared between payers and providers. Um, Fast Healthcare Interoperability Resources, or FHIR, is a new standard for exchanging health information electronically, and it provides a framework for building interoperable healthcare applications, making it easier for systems to share and use data. Blockchain technology ensures secure and transparent data exchange by creating an immutable ledger, and this will verify the authenticity of data, reducing the risk of data breaches. Cloud platforms offer scalable and flexible solutions and enable payers to access and share data in real time, providing a collaborative and coordinated environment for healthcare providers. Health information exchanges facilitate the electronic sharing of health-related information among different organizations, and they improve the accessibility and quality of patient data, supporting better decision-making and care coordination. And last, of course, interoperability platforms integrate various healthcare systems and data sources, providing a unified view of patient information. They can help by in breaking down data silos and ensure that all stakeholders have access to comprehensive and up-to-date information. Now let's dive into the life sciences submarket and some of the challenges faced by biotech, pharmaceutical, and medical device companies. I wanted to show some different settings within the life sciences industry of where technology could be implemented. I did this with the provider submarket, not as much with the payer submarket as with the payer submarket. those care settings are going to be pretty much the same as the provider. Sometimes healthcare insurance companies actually provide healthcare services. So if you think back to some of those settings, that's some of the technology they need. The life sciences industry is when you're looking at their process, there's research and development of medical devices, pharmaceuticals, biotechnology in the labs. So needing obviously computers, laptops, peripherals for these research and development areas. Clinical trials, as I'll be talking about in a minute, traditionally done on site at some of these companies, but there is a move to make these more decentralized and remote. So if you think back to some of those technology needs in the home care settings of the provider industry, there's similar technology needs for these decentralized clinical trials, such as tablets or laptops and peripherals, especially, like I said, as they're trying to bring these services to the patient and make it more convenient for them to participate in these clinical trials. Manufacturing and distribution, there's a lot of needs for computers, networking, barcode scanners, labels, and even video for obviously security, but also as AI is being put into computer vision and videos, it can be helpful for quality controls and looking for products on the manufacturing line that don't meet the minimum requirements for going through to distribution. And then when you're looking at the front line, when you're with your the sales reps within these companies needing to be on the go with their tablets, laptops, and even thinking about barcode scanners for the samples that they're handing out. One of the key challenges that the life sciences industry is facing is regulatory changes, and some of these include navigating the evolving regulatory landscape for digital health and AI technologies, including data privacy, cybersecurity, and intellectual property concerns, the complexities of varying regulatory requirements across different regions, which can lead to increased costs and delays in product development and market access, balancing the need for sustainable practices with the industry's high energy and resource consumption while trying to meet global sustainability goals and regulatory demands, and managing increased regulatory scrutiny and ensuring adherence to complex compliance requirements can be very resource intensive and challenging to maintain. So it's important for the life sciences industry to adopt technology to navigate these regulatory changes. Again, there's a lot of use for AI in this area, analyzing data, regulatory data, identifying patterns, and predicting potential compliance issues. It can also automate routine compliance tasks and reduce the burden on compliance teams. Blockchain provides a secure and transparent way to track and verify transactions and data exchanges. It ensures data integrity and helps in maintaining accurate records for regulatory audits. Digital compliance platforms integrate various compliance processes, providing a centralized system for managing regulatory requirements and offering real-time updates on regulatory changes and help in tracking compliance status. Predictive analytics tools can analyze historical data to forecast potential regulatory risks and compliance issues. And this allows companies to proactively address challenges and stay ahead of regulatory changes. Cloud platforms are useful to life sciences companies as we've talked about the scalable and flexibility of these solutions, and they can help in managing regulatory data and compliance in real time, allowing for collaboration, data sharing, and improved efficiency. Electronic data management systems streamline the management of regulatory documents, ensuring all necessary documentation is easily accessible and up to date. And this is helps in maintaining compliance with regulatory requirements. And then last, the Internet of Things, IoT devices monitor and collect data in real time, providing valuable insights for compliance monitoring. And they help to ensure that products and processes meet regulatory standards. Research and development speed is another key challenge within this industry. The average cost to bring a new drug to market is approximately $2.6 billion and can take 10 years. Medical devices, very similar time frame, a little shorter at 3 to 7 years, but can cost over $31 million. So this just shows how critical of a need it is to accelerate the research and development process to save costs and deliver these innovative treatments and devices to patients sooner. But some of the challenges that the industry faces in the research and development process are um, patient recruitment and retention. Recruiting and retaining participants is a significant challenge. Many potential patients are unaware of clinical trials or have misconceptions about them, leading to low enrollment rates. There's high costs associated with research and development as clinical trials are extremely expensive. Um, Expenses include staff salaries, data management, regulatory compliance, and participant compensation. And this can limit the number of trials conducted and may lead to early termination if funding runs out. Navigating the complex regulatory landscape that we've already talked about is also a challenge. Clinical trials must comply with various national and international regulations to ensure patient safety and data integrity. This involves extensive documentation, regular audits, and adherence to good clinical practice standards. Managing and analyzing the vast amounts of data generated in clinical trials can be daunting for life sciences companies. The increased diversity of data sources and the need for real-time data integration add to the complexity. Ensuring data quality and consistency across different platforms is essential for a reliable trial outcome. Some of the technologies that the life sciences industry is implementing in the R&D process are, uh, drum roll please, artificial intelligence. AI is being used to analyze the large data sets produced in these clinical trials, identify patterns, and accelerate drug discovery and development processes. It helps in predicting outcomes, optimizing clinical trials, and personalizing treatments. Big data and analytics. Big data platforms and advanced analytics tools enable researchers to process and analyze vast amounts of data from various sources. Um, Cloud computing, these solutions, again, are offering scalable and flexible infrastructure for storing and analyzing research data, enabling collaboration among researchers, and improving data accessibility while reducing costs. 3D printing technology is being used to create models of organs, tissues, and medical devices, and it supports drug testing, personalized medicine, and the development of innovative medical solutions. And then last, IoT devices collect real-time data from clinical trials, laboratories, and patient monitoring systems, and this data helps in improving the accuracy and efficiency of the R&D process. Supply chain management is the last challenge that we're going to talk about today for the life sciences industry. Effective supply chain management is crucial in the life sciences industry as disruptions can lead to the total healthcare supply chain costs, which already averages about 37.3% of the total cost of patient care. And so Some of the challenges that the life sciences industry faces with their supply chain management are the need for cold supply chain management. Many products, such as vaccines and biologics, require temperature-controlled environments throughout the supply chain. Traceability and transparency, ensuring the traceability of products from manufacturing to delivery is crucial for patient safety and regulatory compliance. Demand forecasting, accurately predicting demand for products can be difficult, leading to either shortages or excess inventory. Supply chain disruptions, natural disasters, geopolitical issues, and pandemics can disrupt the supply chain, affecting the availability of critical products and counterfeit products. The risk of these entering the supply chain is a significant concern, requiring robust verification processes. Some of the technologies supporting supply chain modernization include blockchain, enhancing traceability and transparency by providing a secure, immutable ledger for tracking products throughout the supply chain. Internet of Things devices can monitor environmental conditions such as temperature and humidity in real time, ensuring proper cold chain management. AI and machine learning technologies can improve demand forecasting, optimize inventory management, and predict potential supply chain disruptions. Advanced analytics help in analyzing large data sets to identify trends, optimize processes, and make informed decisions. Robotics and automation streamline manufacturing and distribution processes, increasing efficiency and reducing human error. And then RFID and barcode technologies enhance product traceability and helps in verifying the authenticity of products. So as you can see, there's a lot of opportunity for technology within these three submarkets to assist with the challenges each are facing, along with those overarching challenges that face the entire healthcare ecosystem. Some of those big buzzwords that were found over and over again were AI, uh, blockchain technology, a lot of data analytics, all working in support of improving the delivery of care to patients and assisting with provider and staff workflows. So thanks for listening.
Well, that wraps up today's session. Thank you all for joining us for the TD SYNNEX Public Sector Spotlight Series. We hope you found this discussion valuable. A special thank you to Meg for sharing her expertise and to all of you for your time and commitment today. If you have any further questions or would like to continue the conversation, please feel free to reach out to me, Felicia Cortez. It's felicia.cortez@dlt.com. Have a great day, everyone.